Control for a free quote or a free evaluation.
When the weather is nice, most of us want to get outside, do some work around the house. If you don't, chances are your wife probably has a honey-do list for you. Dr. Jason Wamack is all too familiar with those honey-do lists. He joins us this morning from the Center for Sports Medicine, not because he has his own to-do list at home, but because you often are seeing patients who have some injuries as a result of theirs, right?
That's right. We are seeing kind of as spring and summer hit, a lot of people getting out and doing things on ladders and get more active, doing cardio and walking the dog. You're seeing more and more foot and ankle issues. You know, a frequent thing that happens is people roll their ankle or doing things, playing sports more. And those are things that, typically come up as we get more active.
You and I were having a conversation about the re-injury that can occur with a sprain. I don't mind saying I'm 51 years old. When I was in the 3rd grade, that's a long time ago, I had a doozy of a sprain on my ankle. And to this day, Dr. Wamack, I feel like that ankle is kind of weak. Am I crazy?
No, it's actually very common. We see that a lot. The big thing with these chronic ankle sprains is someone may have had an injury, years ago and it never healed right. And what we're looking at is the ligaments on the side of the ankle is a band of tissue, and they kind of act like a rubber band, and they bind bones to bone and give stability. When you roll an ankle, there's 3 basic degrees that happen. You can either stretch it, you can partially tear it, or you can rupture it. And most people that have a partial tear to a rupture, and those are kind of grade 2s and 3s, if you don't protect that and it doesn't heal right, and you don't rehab it right, then that ligament becomes loose and it becomes incompetent. Even though it may quote unquote heal, it would be like a stretched out waistband. And so it never gives you that stability. And so when you're on uneven surfaces or you're starting to do something or even wear a pair of wedges, you feel like, oh man, this thing could go if I hit it just right. For that, it's a little different treatment than the new ankle injury. But for those, if someone hasn't had an evaluation, it's a good idea to do it because physical therapy can help depending on the degree. Ankle bracing is important. And then the worst case scenario is surgery, but highly successful in the procedures we're doing. The recuperation time is not bad. Most of our high school and collegiate athletes are back playing their sport, usually within 12 to 14 weeks. Considering it's a reconstruction procedure, it's not very much. We have a lot of kids that get back real quick. But that's a surgical discussion for those people that roll it a lot.
So how much of the conversations you have with your patients, since you do specialize in foot and ankle, ties into the type of footwear your patient wears? Is that an important part of the success?
It is. The good news about, a lot of these, if you treat them right, they typically are not super restricted. I mean, those are the extremes of stilettos and things that we try to keep people out of, but that's the obvious ones. We see a lot of trail runners, ultra runners too. And, for those people, you got to be careful. Some really good running shoes are the high density shoes. They're great running shoes. I like them. But you get on the trail and you hit a root or something like that, you got to be careful of that. And someone has a history of chronic ankle instability, we just have to have that discussion of like, hey, we're putting that ankle in a position to roll or tilt. We got to be careful and make sure your ankle strength is up to par. And there's different ways to measure ankle strength for those athletes to get more objective data on how weak or how strong their ankle is.
Okay, let's talk a little bit about 2 different scenarios here, because you were talking about trail running. A lot of folks are getting active again, as you were mentioning to me. So we can talk on one hand maybe about some conditioning before you begin a workout, and then I do want to touch on the honey-do list too. So let's start with the workout. If you're going to go run, play tennis, you name it, is a warm-up and a post warm up or whatever, a cool down, are those very important to protect your ankle?
Well, yes and no. The problem with that is, injuries happen. And so this is not a muscle or a tendon typical problem, it's a ligament. And so warming up, I will say it's definitely important, but to say it's going to keep you from rolling your ankle, that's a hard one to say for sure would prevent it. So an injury versus someone that has a loose ankle long term. So a new injury, yes, warm up, but there's no great way to say, oh, if you warm up properly, you're not going to roll your ankle, unfortunately, because again, ligament. Someone that has a history of rolling the ankle, it's more bracing, and obviously proper warm up is important. but bracing it and kind of putting your ankle in a position, if it's going to tilt or roll, to have some of that external support, in my opinion, is probably going to be a little bit more important than, warming up your hamstrings and your calf muscle, the gastroc, and things like that. And as far as the honeydew list goes, yeah, it kind of goes into a little bit of, the injury side of things. And so being careful on ladders, I until I got in this profession, I never thought twice about getting on a ladder. Now, every time I'm on a ladder, I'm sitting there thinking about patients that come in falling off ladders and having injuries, only falling maybe 2 feet. And that happens on a daily basis. So a lot of the things, with the honeydew list is injury prevention, putting yourself in a position to not get injured and not doing dumb stuff on a ladder. Hindsight's 20/20 on a lot of that.
Don't wear flip-flops, right?
Right.
Okay, so let me ask you this on the foot side of things too. A lot of us have gone through life not really thinking about our anatomy all that much, but I guess if you have any kind of issue with your foot, that can then work its way up to your leg and into your spine, right? So are there sometimes undiagnosed foot problems that are giving people other symptoms, if you will?
Yeah, no question. There's several conditions. One is, people with excessively flat feet, and particularly one condition called posterior tibial tendon dysfunction, big fancy word, of where the foot not only is just a low arch, but the foot kicks out really hard to the right or left. And so that can affect the alignment of the ankle, affect the knee, and obviously all the way up to the lower back and hip. So A affects B affects C, no question. That's a little different than the rolling of the ankle scenario, but some people have excessively high arches, which is the opposite. And so they're going to put more pressure on the outer side of their ankle, and their foot turns inwards, kind of like a leg of a table that turns inwards, and then all of a sudden the momentum is going outwards. Well, that too will affect the ligaments and the tendons and sometimes into the knee. So no question, I think observing foot structure, and particularly, hey, certain shoes make my foot better, and by the way, when I wear that, it makes my knee feel better too. Those are things to kind of be aware of, because no question, alignment, is a domino effect all the way up. And some people can have knee replacements I've seen, and the knee replacement is beautiful, but all of a sudden they've realigned the knee really well, and the knee's doing great, but it kind of tweaked the ankle, and so all of a sudden it puts a little bit more pressure into the arch. So it's this balance that's sometimes hard to maintain, but being observant about how A affects B, I think, is important.
So we've had a lot of information to get packed into one conversation. I'm grateful for that, and I know you're talking to your patients about their individual needs all day long. Can people self-refer to you, or do they have to have a primary care doctor send them your way?
No, they can call the office anytime and get an appointment. Occasionally, the insurance kind of depicts some of that, but for the most part, they're welcome to call in anytime. And as far as ankle sprains go, there's a great website that kind of goes into those people that are having chronic ankle issues. It's anklesprain.com. Make sure I'm saying that. Anklesprain.com.
Okay.
And it goes into people that have had long-term ankle issues with rolling it frequently, and it kind of gives people kind of some up-to-date kind of technology that we're doing for those people that have had a long-term issue with it.
Excellent. Well, thank you so much for your education this morning, and be careful if you get on that ladder.
All right, y'all have a great day.
You too. You can find Dr. Wamack at the Center for Sports Medicine. Their main office there on Macaulay Avenue. 624-2696 is the phone number. Sportmed.com is the website. We're back after this.
If you've been involved in a wreck with a commercial vehicle, these cases are complex.